Let's talk about something that might sound intimidating at first: spinal x-rays and just x-rays in general. Why do so many people hesitate to get them done? Is it the radiation, the unknown? Maybe it's the fear of just being told something's wrong. So we're going to break this down now to get to the bottom of why spinal x-rays are not something to be feared or avoided, and how they can actually protect your health. Welcome back to Back Talk with Dr. Ryan Wohlfert. I'm Dr. Ryan, and on each of these episodes, I address the most common questions and misconceptions about back pain and spinal health in general, so you can address them and strengthen your spine and be your own guarantee for your health in your life. Today, it's an important topic. It's going to be one of my favorite videos. It's going to be one of my most important videos because of the hysteria around x-rays and getting x-rays done. Right now, we're going to get into the 7 common reasons why you shouldn't fear or avoid x-rays. So let's get into it. All right, so here we are, 7 reasons not to fear x-rays. So number 1, let's jump right into it. Let's clear this one up right now. So low dose radiation is not unsafe. I can't say it's completely safe, because really nothing is completely safe depending on how much you get, but it's low dose radiation. It's common to hear people worry about x-rays because they involve radiation, and no one wants to hear that word radiation when it comes to their body. But here's the thing: the dose of radiation you get from a spinal x-ray is really tiny. It's equivalent to what you'd naturally be exposed to just in living your life for a couple of days. Your body is built to handle these small doses. And in fact, your cells have natural repair mechanisms that fix minor effects almost immediately. So put it in perspective. If you fly, you get on an airplane, we think about cruising at these high altitudes, you're exposed probably from more radiation, not even probably, you are exposed to more radiation from cosmic rays, than you are from a spinal x-ray. Yet most people don't even think twice about getting on an airplane because of that. So it's not something to fear, especially if it gives us clear, actionable information about our health. Number 2, radiophobia. So the fear of radiation is based on misconceptions. People hesitate for it. This idea that any exposure, no matter how small it is dangerous. This belief is based on an old model called the linear no threshold theory. And it assumes that even the tiniest amount of radiation could be harmful, but modern science doesn't support this anymore, especially for low dose exposures like x-rays. There's no evidence that these levels of radiation cause harm. The fear itself has outlived the science. In fact, that leads to the next point: the body's protective mechanisms. So that leads to health benefits like improved DNA repair mechanisms. It's an adaptive response and could even reduce the risk of certain diseases. So again, radiation hormesis, your body adapting and being able to handle these low doses. But now let's get into what spinal x-rays can actually do. So number 4, medical imaging enhances diagnosis accuracy. So they give doctors and chiropractors, corrective chiropractors like myself, a detailed look at what's happening with your spine. This is huge because your spine isn't just about your posture. Your posture, it's a window to your spine and nervous system function, but the x-ray actually gets to the inside of it. It's like looking under the hood of a car if the check engine light is on. We just can't address it from the outside. So it's the highway, like I said, of your nervous system. It carries the nervous system, controls all function of the body. It carries these signals between your brain and the rest of your body, and then your body to the rest of your brain. If there's something that's off with your spine, if there's injuries, weakness, distortions, abnormalities, that ripple effect can lead to whole body dysfunction. So I want you to imagine this. Imagine you're driving down a busy road and suddenly there's a construction spot and it's blocking part of the highway. Everything slows down, right? Or maybe even completely stops. Maybe you can still get to your destination, but it takes longer. You might have to take a detour, might cause more wear and tear on your car. Your spine works much the same way. If there's a distortion or a misalignment or an issue, it can disrupt the flow of information. It can disrupt the nervous system function in your body. So x-rays help to pinpoint these construction zones so we can address them. Number 5 here. So incidental findings can save lives. Well, with incidental findings, it's stuff we might be able to find on there that maybe you didn't even know was there. I mean, there's been cases of bone cancer, and not that I want to scare you with that, but those are always of findings that can show up. There was a case a colleague shared of mine where he took the x-rays and found an infection in the bone that was breaking down the bone that nobody else caught because they weren't looking for it, or they weren't looking for it, but they didn't take the necessary imaging to find out. So that's why, again, reason number 5, why we don't want to fear or avoid x-rays. Catching these things early can be life-changing, life-altering, right? So finding and addressing a small structural issue, just even on that level, a small, distortion of your posture and spine, addressing it now can prevent chronic pain and other issues and organ issues and other, aging issues that you might experience down the road. Number 6. So avoiding x-rays can lead to greater risks, which again, that goes to the, previous point as well. If we keep skipping them, doctors might rely on less precise methods to figure out what's going on, more invasive methods to figure out what's going on, maybe even surgery because they wanted to avoid a low dose x-ray that's not really going to harm your body. Your body can deal with that certain amount of radiation. Or like in the past, like I just said in number 5, is you might miss something important. So it's like trying to pop and fix, or I shouldn't say pop, but pop the hood of the car, or not popping the hood of the car and trying to figure out what's wrong in the car without doing that. It's a gamble. Now, I want to address something right now is it relates to kids and children. It's a common concern. Parents worry about exposing their kids to radiation, but avoiding it can sometimes, many times, mean putting kids through riskier procedures like needing sedation or an MRI. So for many kids, a quick x-ray is safer and far less stressful than the alternatives. So let's finish up now, number 7. All right, so let's also touch on this fact. So today's x-ray machines are really, really advanced. So they use technology that minimizes radiation exposure while still providing detailed, high-quality images. Now, it's not the clunky, high radiation imaging of decades in the past. It has come a long way, and safety is a huge priority. Here's a good way to think about it. So think about trying to take a clear picture in a dimly lit room. Now, without the right equipment, you might have to use a longer exposure time. You might risk having it blurry or distorted. But with these new x-ray machines, these digital x-ray machines, you can capture a crisp, sharp image in an instant and quickly with less radiation. Modern x-rays, again, use it the same way, giving doctors, give us the clarity that we need without unnecessary exposure. So just bottom line, big picture, x-rays are a tool. They're an important tool. These 7 reasons are just 7 of those reasons, and big reasons. There's probably more, but they a lot of times fit into these 7 reasons. In understanding your health, especially your spinal health, making informed decisions about your care. And we need to use them appropriately. They help us provide more effective treatments and avoid any necessary guesswork. Now, I do have something I want to mention here, because I do these virtual posture and spinal mobility assessments. We look at your posture, we look at your mobility to see, okay, are there signs of injury, damage, weakness that's shutting down that vital, crucial energy flow, the information, the communication from the brain to all the different cells, organs, and tissues of your body. And then same thing, that communication from the cells, tissue, organs up to your brain. Now, this is an overall view to see how your posture is affecting, and then possibly, getting spinal x-rays. All right. But we have to start with this to see, okay, what does your posture look like? How's your spinal mobility, especially if you're dealing with back pain, neck pain, headaches, arthritis, the hunchback, immobility. You're not able to get up and down from the chair like you used to. You're not waking up refreshed. These are all signs that there's some sort of postural or spinal distortion, weakness in your body that's shutting down that vital energy flow and preventing you from being your own guarantee for your health and your life. So in the description, in the comments there, I'll put a coupon code for $20 off your one-on-one posture and spinal mobility assessment with me. All right. In the meantime, I want you to be your own guarantee for your health and your life, and I want to help you do that.